Right, ladies and gentlemen, good morning. Good morning, I'm Jeremy Haigh. I'm very pleased on behalf of EFPIA to welcome so many of you here today to this 90-minute session on MAPS, Medicine's Adaptive Pathways to Patients. And as the title optimistically says, saving time, saving lives. I may not be the only person here who actually thinks that that title could usefully include saving money, but it's not there. Maybe in time it will be. I know that's a contentious discussion and something we'll come back to perhaps in the next hour and a half. For those of you who are new to this concept, MAPS is, if you like, an ambition. What we want is to provide patients with unmet medical need more timely access, and that really means faster access to new medicines, and to do that within the current regulatory framework. And so the objectives for this session are actually quite simple. We want to be able to build on the recommendations that came out of a similar session at last year's AGM. And many of you may have been at that session, I hope you were. We want to be able to demonstrate the progress that has been made over the last year, and I think we also need to be able to describe how we intend to move this initiative forwards. Now, clearly, this is an area that has many stakeholders in it, many. And therefore, I really hope that as a consequence of today's discussion, we can at least ensure across all of the parties who are involved in this that there is a complete understanding of what MAPS actually is. In addition to that, that there is a very clear understanding of why MAPS is so important. And thirdly, what needs to change in each of the elements of the healthcare sector to make this initiative successful. Now, I would say one other thing at this point. When this session was originally conceived, it was going to be an industry-only session. But rightly, the decision was made to broaden it out, to make it open. And that's right, because there are so many other elements to this debate than just the industrial perspective. What you will see, however, is that those who come to the front of the stage don't necessarily represent all of the elements of the healthcare ecosystem that we are trying to influence. We acknowledge that, but that does mean that we are even more dependent on each of you to engage in the discussion from your own perspectives and make sure later on this is a truly cross-functional, cross-sector engagement. So without more ado, I'd like to just show you today's agenda. You'll see that at the end there is a panel discussion. We'll get to that. And in the middle, we're going to have what we've called some progress reports, really to give you a flavor of where we've come from, what we've been doing, what we hope to achieve.